The purpose of this research endeavor is to determine the effects of a pandemic on cooking and eating habits. During the time of COVID-19, most people are forced to stay at home in order to flatten the curve. Without the convenience of eating out, people should be more inclined to cook on their own, potentially leading to healthier diets. Additionally, people should be more willing to experiment with recipes and be more creative with the ingredients they have on hand. According to an article by the International Journal of Behavioral Nutrition and Physical Activity, some factors that contribute towards dietary habits include accessibility, familiarity, priority, and dietary restriction. Accessibility refers to access to grocery stores, food and ingredients people typically consume, as well as access to restaurants and other food sources. Familiarity encompasses people's comfort level with dealing with certain ingredients. Cultural food is a good example of a type of food someone might have more experience with and therefore more comfortable cooking and eating. Priority refers to the level of importance cooking has compared to other tasks. For some, cooking is time that could be spent doing other things such as work or going out. Also, dietary restrictions refer to religion, allergies, food preference, and other restrictions that limit diet options. My research has been conducted through the use of a Google form. This way, it was possible to obtain a widespread sample in a minimal amount of time. Questions regarding typical cooking habits, comfortability cooking with certain vegetables, willingness to try new recipes, and familiarity with farmers markets were asked. Participants were also free to add additional comments regarding their situation. These questions are to help determine how COVID-19 and quarantine conditions affect typical eating habits. To collect my data, a link to my survey was sent out in emails as well as posted to several Facebook pages. These outreach sources were chosen in order to target adults who typically provide food for the family by shopping, cooking, or otherwise purchasing food. This was an important factor in my study in order to limit the survey to people who normally cook to accurately calculate the change in cooking and eating. Out of the 570 participants, 45.3% of people cooked 3 to 4 days out of the week prior to the pandemic, making it the largest category. Also at this time, 26.8% of people cooked 5 to 7 days out of the week. Now we can see how this compares to post-pandemic cooking habits. There has been a drastic increase in people that cook 5 to 7 days a week, from 26.8% to 69.8%. People note that they have more time to cook since they need to stay at home and have limited access to restaurants. They have also become more adventurous and creative with recipes based on their access to ingredients. Additionally, outside research by the Public Health Nutrition Journal suggests cooking at home leads to healthier eating since those that cook tend to consume fewer calories compared to those that don't cook. This data is out of the 290 participants that chose to comment. Some common themes show that people are limited to eating what is available through minimal shopping trips, even if they aren't necessarily familiar with the product. Because of this, people have one of two options: to adapt and be resourceful with the items they're able to acquire, or to turn towards convenience and eat what's readily available. Out of those that chose to improve their diets, many stated they wanted to build their immune system to prevent illness. Additionally, due to quarantine conditions, there is limited access to restaurants and more time to spend cooking at home. For those that turned to poorer habits, stress and convenience were the most common reasons. Spending more time at home also poses as a distraction, which can lead to inconsistent eating patterns. This is the number of people with access to local farms versus those that actually buy from them. They are an underutilized resource that can help sustain communities during times of crisis. Local farms and farmers markets are often overlooked since grocery stores tend to be more convenient as they have more variety. However, in times of a pandemic and other crises, they can be useful when other basic items are limited or sold out due to panic buying. For those that want to limit outings and interactions with others, creating a backyard garden is another alternative solution, which could provide temporary food security in an uncertain situation. Backyard gardens help to decrease pressure on the food supply and can help save money by substituting items that would otherwise be purchased from the store. The addition and utilization of local farms and personal gardens increase fruit and vegetable accessibility. More accessibility to fresh produce positively affects diets as people steer away from heavily processed foods towards incorporating fresh produce in their diets. Diets are not the only thing impacted by this pandemic, as shown by other individuals who commented on their lifestyle changes. Many stated that they are spending more time with their family, turning toward shopping alternatives such as curbside pickup and delivery, spending time outdoors and going on walks, as well as trying to support local restaurants. While diet has a large impact on health, it's important to recognize physical and mental aspects that contribute towards overall well being. There are pros and cons to every situation, and this pandemic is no different. Although it is a confusing and stressful time, there seems to be a silver lining in which people are cooking more frequently than before. However, people are also turning towards comfort foods and snacking to cope with the situation at hand. When things return to pre pandemic conditions, people will most likely resume their quote unquote normal life. As with every other crisis situation, from natural disasters to epidemics, people become more aware of the possibility of what could happen. This awareness makes them more informed and therefore more prepared on what to do in the future. This can prevent accessibility issues that are prevalent due to panic buying, paving the way for new policy and organizational measures for future scenarios. As for right now, local farms and backyard vegetable gardens can help sustain communities during the pandemic by providing fresh produce that is relatively easy to access.